The news cycle over the past several days has been nothing short of tumultuous, bringing together an unusual combination of political, social, and economic developments that together paint a picture of a nation navigating both internal strife and consumer-driven opportunities. On the consumer side, Costco has made a bold announcement that has caught the attention of millions of Americans. It is now offering Ozempic and Wegovy at half the usual retail price. These medications, which are primarily prescribed for the management of type 2 diabetes and obesity respectively, have surged in popularity over the last several years, becoming some of the most sought-after pharmaceutical products in the country. Their popularity has not been without controversy. Critics have pointed out that the high cost of these drugs has placed significant strain on patients who rely on them for chronic conditions, with prices sometimes reaching hundreds or even thousands of dollars per month. The decision by Costco to cut these prices in half is likely to have a ripple effect throughout the healthcare and retail industries, potentially encouraging other major pharmacies and grocery chains to reconsider their pricing strategies. At the same time, this move could create both logistical and supply chain challenges, as the sudden surge in demand might strain the ability of manufacturers and distributors to meet consumer needs. Patients who had been waiting in long queues or on months-long waiting lists for access to these medications may now be able to obtain them more quickly, which could improve both adherence and health outcomes. However, this also raises questions about equity and sustainability, whether such discounts will be permanent, whether other insurers will follow suit, and whether the sudden affordability will inadvertently trigger shortages for those who truly need the medication. The broader societal implications of this move extend into ongoing debates about healthcare accessibility, corporate responsibility, and the role of market forces in determining the availability of life-changing treatments. While Americans digest the news about medication pricing, a far more pressing and immediate concern is unfolding at the federal level, where hundreds of thousands of employees are currently working without pay due to a partial government shutdown. This shutdown, which has affected multiple agencies and critical personnel, has placed an extraordinary burden on employees who are required to continue performing essential duties while navigating financial uncertainty. Among the most sensitive and high stakes of these roles are air traffic controllers, whose responsibilities directly affect the safety of millions of travelers every day. The risks associated with furloughs and unpaid labor are not merely theoretical. In a stark illustration of the dangers posed by understaffing, the control tower at Burbank Airport went entirely unstaffed for 6 hours on a recent D. As the political, legal, and social stories of the moment unfold, one of the most persistent threads involves Donald Trump and his ongoing connection, or perceived lack thereof, to the controversial and highly scrutinized figure, Jeffrey Epstein. Trump has repeatedly asserted that he has no connection to the now infamous Epstein birthday letter, a statement aimed at distancing himself from one of the most sensational scandals of the past decades. Yet, the complexities of the Epstein case, combined with the high-profile nature of those involved, have made it difficult for observers, journalists, and legal analysts to accept such claims at face value. Epstein's network of associates included a wide array of influential figures, spanning politics, business, and entertainment, which has fueled extensive speculation and investigation into who knew what, and when. Independent research efforts, including detailed analysis by investigative journalists, legal experts, and documentarians, have attempted to piece together a coherent timeline and verify the authenticity of letters, photographs, and other materials that may indicate Trump's involvement or knowledge of Epstein-related activities. These investigations often face significant obstacles, including sealed documents, limited access to evidence, and the complexity of verifying documents from decades-old events, making it a difficult and ongoing challenge to separate fact from conjecture. Each piece of information released or discovered has the potential to reshape public perception, influence ongoing legal inquiries, and generate renewed media scrutiny, creating a feedback loop in which speculation, reporting, and political commentary continuously interact. The stakes of these inquiries are amplified by the real-world consequences of political gridlock. Federal employees remain at the forefront of these tensions, balancing their essential duties with the financial strain of unpaid work during a partial government shutdown. This situation has impacted hundreds of thousands of Americans, including workers in aviation, national security, regulatory agencies, and other sectors vital to the functioning of government and public services. Beyond immediate financial concerns, these employees face profound psychological and logistical challenges. Many must make difficult decisions about household budgeting, childcare, and long-term financial planning, all while remaining accountable for duties that, if neglected, could have significant consequences for safety and public trust. In the aviation sector, the understaffing incident at Burbank Airport, where the control tower went unstaffed for 6 hours, serves as a stark reminder of the potential risks associated with furloughs. Airlines, passengers, and airport authorities were forced to adapt to sudden disruptions, highlighting how deeply the effects of governmental paralysis can permeate daily life. These events underscore the tangible human cost of political